Okay, so welcome to the first lecture, which is My Patient is Pregnant. On your chairs, and for those of you who are attending virtually, but the people who are in the room, you've got a red-green card saying yes or no. Do feel free to be interactive in the next little couple of slides. Those of you who are at home, have a think about this and whether you would answer yes or no. So firstly, have you yourselves ever personally treated a pregnant patient or client? So for the most part, oh, I don't know, we're changing. We were green, it was lots of yeses, and we're down to majority of no's. Okay. Another question for you then. Do you worry about treating a pregnant patient or client? So again, you know, I'm seeing a lot of red. And no's online as well. So there we go. I think that everybody is saying no here, no worrying. Really, if we think about it, you know, it's quite amazing, isn't it? It's almost miraculous how, you know, we go from an egg and a sperm, it creates a human being, you know, that's born into the world. And eventually those babies, well, they grow into toddlers, don't they? And then, you know, those toddlers grow into children, into young adults, and eventually have families of their own. And so the cycle continues. But if we think about patients or women, you know, who are pregnant, at any stage in pregnancy, would you say that you have any concerns? So think about it in your own minds, just for a moment or two. If you did have any, what would be your concerns of treating somebody who's pregnant or expecting a baby? Now, there's no right or wrong answer. And you might be thinking, well, I wouldn't have any worries, I wouldn't have any concerns. You know, for some of you might be thinking, ooh, you know, I've got lots of them. In fact, you know, you might need a brown paper bag right now in case you're feeling like you're going to hyperventilate. But it might be your own personal experience. You know, if you've never treated somebody who's pregnant, you know, you might be worrying as to whether you're going to do or say the right thing. What treatments should you undertake or potentially avoid in pregnancy? You might be thinking, oh, what would I do if I had a pregnant patient and she felt unwell, you know? Or worse still, went into labour? You know, can you imagine trying to pop out a baby whilst you're clipping nails or enucleating a corn, you know? Excuse me, can you keep still, please? Yeah, I've got a sharp implement. But, you know, another thing is there any link between pregnancy and what might manifest in the lower limb? And is there anything that maybe we need to be aware of? So all of these things are careful considerations, not necessarily an anxiety. We don't need to book immediately into seeing a psychotherapist about this or a psychologist, but it's an awareness of, you know, potentially our limitations. When we look at how pregnancy can, you know, impact, there's lots of different ways. If we take them each one at a time, you know, there's the physical aspect, isn't there? Lots of physical changes. Potentially mobility, you know, might be easy when you're only a few weeks pregnant and, you know, physically you're not looking any different, you're not feeling any different perhaps, but, you know, when you're about to drop, you might feel, you know, that doing certain things are difficult or walking feels a little bit laboured. Some of the challenges might be emotional. You know, not everybody sails through a pregnancy happy and bouncing. You know, some people find it maybe challenging or the pregnancy is difficult for them. Also, if we think about it, the whole ethos is very hormonal, isn't it? And if we think about hormones, we can feel happy, we can feel excited, we can feel sad, we can feel depressed, we can feel impending doom. And sometimes it's a bit of a roller coaster ride, isn't it? And you just have to put your seatbelt on. Some of it's psychological, you know, am I ready to be a mum? They might be thinking these things, you know, am I ready to have a family? You know, so when we're looking at treating our patients, you know, and they're announcing to us that they're pregnant, just be sensitive to, for for some patients, for some women, it might be that roller coastery ride where they may be a little bit confused as to how they feel, or perhaps anxious, waiting their scan, etc. Quality of life can sometimes be impacted, particularly when a woman's pregnancy isn't going quite so smooth. And maybe they've got to go to lots of appointments, maybe they're told that they've got to stay in bed for the next 3 months, so it's important to remember that as much as it's great when everything goes swimmingly, and everything goes nicely, sometimes people are not dealt those easy cards, and it's a little bit more of a challenging time. Lots of physical changes that can occur. And it might be others, you might be sitting there thinking, well, she hasn't mentioned this or she hasn't mentioned that. This is just a little bit of an overview. So let's have a look at some of these changes and things that we might observe or, come across or have described to us. So first of all, let's look at the skin, because that's certainly something we spend a lot of time looking at, isn't it? So with regards to the skin, it's well documented, isn't it, that women can have a glow and they look healthy and, almost flushed and, looking well and, almost like this pregnancy glow, as it said. And this is largely due to the increase of blood volume that's occurring inside that woman's body. And, this is required predominantly to go to the uterus and also to be able to provide all the other organs within the body, and also like the kidneys, and all of this sort of like excess blood flow that's being created and manifesting throughout the body causes as well more of the oil glands to secrete oil, so you have a little bit of a glow as well as a little bit of like a blushing appearance. But for some women, yes, they might have the pregnancy glow. Some look pale, don't they? Especially if they've got a lot of morning sickness and might feel like, you're telling me I have a glow. All I'm seeing is the white of the inside of a toilet bowl, But, for some people, they might have that glow. For others, they might experience a change in the skin that's different. Patches of brown or yellowy colors. This is known as chloasma, and it's also known as the mask of pregnancy. Quite often it's seen on the face, they'll have like a little bit of a brown patch or area. It can be uneven and patchy, so for some women that can be a little bit disturbing, if they don't feel that they're uniform from left to right. And what we might also need to be aware of is that some of their moles and freckles that they have develop a few changes. They might become a little bit bigger or darker. And from our point of view, we're very concerned, aren't we? And we have a lot of training and knowledge on things like malignant melanomas and the changes of things like a mole or what have you. And we sort of think of the ABCDE, but it's just to bear in mind that it might be a natural change for that individual. But still, if you're concerned, if you're worried, then we would do the normal of referral, take photos, document everything. Now, chloasma can't really be prevented. It's not like you can stop that from happening. So some people will be more affected than others, but things like sunscreen and avoidance of UV light can help to minimize that, because for some it can be quite severe. Other changes to the skin might include linea nigra. So this is where we can see like a brown line that goes down the central part of the lower part of the abdomen, which we can see in the top picture right there. That's a little bit of a hyperpigmentation that occurs again because of the hormones that are making a few more pigments. And another change that can be distressing for some are stretch marks. Yes, we associate them most commonly in and around the abdomen, and areas of growth. But what we've got to bear in mind is, with pregnancy, sometimes swelling can happen, and it might well be that some stretch marks are occurring in different places. The analogy of eat for two, for some people, they take very literally, and so therefore they'll have stretch marks on buttocks and thighs as well. Acne can be another unwanted but consequence of pregnancy, and that's again due to the glands producing more oil. Some women, I mean, just like we all understand, hormones, can give hot flushes and sweats and things like that. And that can be something that a woman could find quite debilitating during her pregnancy if she's experiencing a lot of sweating. Why would that be, do we say? Well, lots of sweating brings about potential heat rashes, especially in the folds, of skin. So whether it's under the breast line, under the abdomen, depending on how pendulous it is. It might be, with regards to sweating generally, other areas, like the feet might sweat more. We might notice that there's more interdigital lesions as a result, or maceration. With any sort of increased sweating and also, closed spaces can come secondary bacterial infections, and also being aware that sometimes that's a perfect breeding ground for fungi, isn't it? So, there is potential there. Some itches, might be quite debilitating. Certain rashes might be really pruritic, and one of which is a pruritic urticarial papules and plaques, which some women can develop. So this is literally where there's like some type of blister formations, but also some like scaly plaques that can manifest. They'll be a little bit raised, red, quite well demarcated usually, and intensely itchy, a bit like hives, Some will say it's associated with allergies, and some will say it's food intolerances, but it's also a consequence of pregnancy for some women. Other things with the skin to bear in mind is increased sensitivity. So, in our bag of tricks of creams, lotions, potions, and medicaments, it might just be worth remembering that some women will find some creams that they can't tolerate, whether their skin is a little bit more sensitive, and others it might be the smell, that they normally love lavender and rose and all of that, and now they can't bear it. They'd rather open a jar of Marmite and breathe that in, and put that on their skin in copious amounts, or mix it with some weird concoction. But the reality is skin can become quite sensitive, and that's important for us to bear in mind when we're applying any form of treatments or, for example, emollients. Like we said with the sweating, it can be quite debilitating, and for some, it'll also bring about candidal infections. So whether that's on the skin, like interdigitally, because we associate things like athlete's foot as being fungal but dermatophytes rather than yeasts or molds for the most part. But some women will have thrush, and that will unfortunately impact on other parts of their body. Skin can be quite dry. They might feel that their skin is quite, looks like they've not moisturized in 10 long years. They take their socks off and they might find, well, you hope that they're not going to go like that, and it's like a room of confetti. Well, congratulations, somebody's evidently just got married. We would hope it's not quite that scenario, but, skin can become quite dry. And they might experience that on their legs, on their feet. It might be something we observe, but likewise, it could be on other parts of their body, including their abdomen. Faces, can become quite dry. Eczema can develop, with this dryness and anhidrosis. Whereas for others, where they're sweating quite profusely, it might be that instead of the anhidrosis, they're suffering with hyperhidrosis, and so therefore maybe are more prone to things like pitted keratolysis or Pseudomonas nails, etc. It's all sounding great, isn't it? In addition to skin, hair can be affected as well with pregnancy. And for some, those changes are quite positive. Their hair might be, fuller, looking like more shiny, looks like they've had, a 350-pound simple wash and dry in London somewhere. And it might be growing quite well or quite quickly, but for others, unfortunately, they don't experience the thicker, fuller, nicer hair. They might experience the absolute opposite. And for them, their hair might become either very oily or very dry. For some women, they'll lose hair. you know, depending on their nutrients and their diet and things like that. For some, they'll experience a slight change of colour. I mean, we're not talking, you know, from black to grey, you know, although depending how stressed they are, obviously. But, you know, some subtle changes might occur. The general rule of thumb, though, is that changes once everything is back into a normal status quo or homeostatic control after the baby's arrived. Something to bear in mind is for some women, they'll have unwanted hair in unwanted places that they've never had before. So all of a sudden they might start sprouting hairs in and around certain aspects of their body, you know, or on their face or under their chin, or, you know, start to grow a little moustache. But, you know, again, this is all largely because of all the hormones that are being dumped by the pituitary gland, and that can be one of the unwanted effects. We deal a lot with nails as well as the skin and an understanding of what we might or might not see on the patients. And with regards to nails, we might think, well, how on earth does pregnancy impact on nails? Well, for some patients, the nails will grow faster. So what we might find is that their regular appointment might need to be brought forward a little bit to keep them comfortable and prevent, obviously, any unwanted pathologies. For some patients, their nails are nice and strong, you know, or stronger even, and they're saying, oh, my nails have never looked so good, you know, and, you know, they're quite happy to, you know, show them right off. For other patients, unfortunately, that's not the case. And what they might experience is their nails become maybe thinner or start to split or become maybe a little bit thicker and more brittle. So it varies from person to person. That's just something to bear in mind when we're treating them, you know, to be able to maybe give them advice. If their nails are particularly vulnerable or brittle, we might want to recommend like a nail oil, you know, to moisturize them or keep them a little bit better hydrated. We might want to bear in mind that with the nails potentially becoming a little bit thinner or brittle or not as maybe as healthy in appearance, is to consider what we might put on them. So it might be a time to avoid harsh chemicals or like nail polish remover, you know, harsh nail polishes perhaps, or even false nail applications. So you know, that's not saying we don't do it, it's just saying that we have to take each person individually and make a proper choice or give appropriate advice should we be asked. So when we think about our pregnant patients, and we think about potentially the podiatric observations we might have, you know, in front of us, we might see an increase in hyperkeratosis, whether that's in the form of calluses, whether it's in the form of anhidrosis as well. We might see, you know, the whole foot changes. There might be a bit of fissuring, you know, in and around the heels, for example. We might notice some fungal infections or bacterial infections. There might be situations where we observe pitted keratolysis, particularly if the patients are sweating more or have hyperhidrotic feet. And like we said, you know, for others who are quite anhidrotic, they might present more with things like eczema. With regards to one other thing to bear in mind is depending on the stage of their gestation, you know, and how pregnant they are, they might find it quite difficult to self-care, you know, particularly if they're quite independent normally and able to reach their feet without a big deal. For some, they might find that it's just impossible to reach them. In fact, they can't even see their feet, yet alone reach down and cut them. So it might be something to bear in mind that they might need that little bit of extra TLC, but also, you know, be aware that if they try to clip them, or the husband or partner tries to step in and be the podiatrist for the duration of the pregnancy, you know, we just don't know the state of the nails when they come through our door. Another thing that's very commonly associated with pregnancy, and that's because if we think about it, there's an awful lot of hormones that are going through that person's body in order to be able to eventually push something quite big out of something quite small. So there's got to be a lot of ligament laxity and muscles that relax, and, you know, for the body to be able to cope. So it's not unusual to expect somebody to have a little bit of foot pain. And that can be in and around the forefoot, for example, and present more as like metatarsalgia. They might have pain in the arches, you know, where their feet are perhaps flattening a little bit. It might be that they've got pain in and around the heel, depending on how they are distributing their weight at a foot level. So that's something to bear in mind, is that we might see increased calluses or lesions in certain areas, depending on how somebody's getting from point A to point B. We might find that during the course of the pregnancy, particularly if we have a continuity of care with the patient, that we see their natural base of gait getting a little bit wider. And it's not uncommon for the pressures in and around the foot to change. And that's something to be aware of, because their gait is going to change as well. You know, they go from walking like on a catwalk, you know, and strutting their stuff, to a little bit like a duck waddling, you know, depending on how far in they are with their pregnancy and if there's no issues. So their gait might become a little bit unstable. There might be this medial and lateral sway that we might observe. The pelvis is likely to tilt a little bit as well with the increased weight gain that a woman will naturally have. And what we'll find as well is that the larger the abdomen is becoming, and obviously the more weight that somebody is carrying, and obviously their breasts are going to become fuller and heavier as well during the latter part of the pregnancy, is that's pushing everything forward, isn't it? If we think about the gravity of the weight of everything. So how are they going to compensate? They're going to have to waddle like that. And so they'll have an increased lordosis. And that's when you see that, oh, you know, back, and they're walking like this, you know, and that's just purely because of the mechanics, if you like, the biomechanics of the body. There's also the weight gain, you know, that we've said, and the ligament laxity, that when you put it all into one pot and stir it with a large spoon, equates to everything that we might observe, including pelvic pain. If we have a little look here at these series of pictures, we can see that as the fetus is growing and the pregnancy is, you know, moving forward, how these spinal curves change. And that can be reflected with women finding it quite uncomfortable, you know, to sit for periods of time or stand for periods of time. And you've got to think about that when we're also treating our patients, you know, if they're sat for a long time. As well, baby, particularly as it's growing in the latter part of, you know, the pregnancy, might be lying awkwardly, you know, and some women can suffer with sciatica or pelvic pain or referred pain down the legs. Their sacrum might become quite sore. So, you know, that's something to consider when we're doing our treatments. The other things that we might observe or hear of is symphysis pubis dysfunction. So when we're talking about ligament laxity and everything becoming a little bit softer to facilitate for childbirth a little bit later on, the symphysis pubis, where the two innominate bones of the pelvis come together at the front, can sometimes unhinge and unlock, and that isn't holding the pelvis so securely at the front. Some women need to have a belt, you know, to hold their pelvis together so that they can walk from point A to point B. Very painful for them. It's a very uncomfortable experience. So, you know, along with potential lower back pain, like we've said, and sciatica, we just have to be mindful what position they're being seated in, how long they're being seated, and if there's any time where we have to lie the patient down, remembering to, you know, particularly in the last phase of pregnancy, after 28 weeks really, we shouldn't be encouraging them to lie flat on their back, you know, so always be sensitive to that if there's any circumstances that you would need to lie a patient down. Other changes and observations that we might have from a podiatric perspective would be swelling. Some women will have quite a bit of swelling, and that can be in and around their feet, it can be up their leg, you know, in or around the ankle, going through to the shins and calves. For some women, they might account having quite a few cramps, be it in the night or at rest or even during activity. So that brings you know, the significance of us being on point as well with our neurovascular assessments, you know, and if we can't feel the pulses because of edema, you know, to just use a Doppler, gain a little bit of confidence of using the Doppler if required, if you can't palpate them. You know, trying to rule out when they're getting the pain and using our clinical judgment to identify, could those cramps, for example, be ischemic in nature? So we'd be looking for other signs of peripheral arterial disease rather than just jumping on the bandwagon of they've got cramps. That means that they've got intermittent claudication, for example, or whatever. But it would be a case of just being aware that they could develop cramps and also varicosities. Women can experience an increase or all of a sudden develop varicose veins that they didn't have before. Some of those actually settle after pregnancy and disappear. For other women, it will stay put for a little bit longer. So other considerations and other things that they might account or present with would be hypertension. They could develop something called preeclampsia, which is a combination of 3 different signs and symptoms, and potentially it's 2 of the 3. So one is hypertension, the other one is edema, and the third is, you know, the presence of some abnormal bloods. This would be monitored and diagnosed by the midwives and by the obstetricians and team that's caring for the patient, but it might be that they're then put on bed rest, you know, or they're being monitored very closely. Some women, like we said, can develop sensitivities and nausea, particularly in the early part of pregnancy, so it's just remembering that. And some women might have that orthostatic hypotension, you know, where they're feeling a little bit faint or woozy when they get up. So if they've been sat in your clinic for a while or at home for a while whilst you've been treating them, and then they get up to get the payment or, you know, to put their shoes on or something like that, they might feel a little bit lightheaded. Other women might account that they've got quite a few severe headaches, you know, and that they're not feeling generally quite well. It's not uncommon to hear that they're struggling with indigestion, you know, and things like that nausea or heartburn. They might have other problems with their bowel. And from another perspective, especially from us in the world of foot health, is women can develop gestational diabetes. And whether it's gestational diabetes or, you know, other types of diabetes, we just have to be aware of how that can potentially impact on the lower limb. Some women, unfortunately, can experience some incontinence, and that might cause them a bit of embarrassment or the need to stop treatment so that they can go to the toilet. And they might find it quite difficult to find the ambient temperature, a little bit like somebody who's menopausal, perhaps. You know, 1 minute you're cold, 1 minute you're hot, 1 minute you can't cool down. So lots of different potential other causes. I could say to you that, you know, before I became a podiatrist, I was a midwife. And this barely scratches the surface. It takes me back, you know, to all those wonderful years as a midwife. But it's so much is known, but there's also so much that's unknown because everybody is different. And that's something to remember, that each and every expectant mother will feel and experience pregnancy very differently, you know, with each and every pregnancy she has. And what we can do is try to ensure their comfort, avoid any risk. So, you know, if it's something that you're concerned, could it potentially harm the mum? Could it potentially cross the placental barrier? What if she was breastfeeding? Would that be, you know, then don't use it. You know, if there's doubt, then don't, you know, or ask them to consult their pharmacist or their GP. It's better to not do something and to wait till after the pregnancy has, you know, manifested, then rather than, you know, do something and take an unwanted risk, because the bodies are, you know, our bodies are quite unpredictable sometimes, aren't they? And always remember, we are part of a multidisciplinary team. Sometimes it feels like we're alone, you know, and that you don't know where to go or who to ask, or you feel like you're a little bit of a lone worker, but we are part of a greater team. And that's the beauty of our profession. And I would just like to thank you. All right. Any questions? No? Perfect. All right. Well, if you can just